Welcome to our topic 6 under our module 1 on antimicrobial agent, and we are going to discuss anti-metabolites. Let me share my screen with you. We will discuss anti-metabolite, and so what are those? An anti-metabolite is actually a chemical that inhibits the use of a metabolite, which is another chemical that is part of bacterial normal metabolism. So this looks quite strange and maybe complicated, but we will try to understand this. So an anti-metabolite is a chemical that inhibits the use of a metabolite. Now, a metabolite is another chemical that is part of the normal metabolism of the microorganism. So such substances are often similar in structure, as we can realize that they are similar in structure to the metabolite that they interfere with, and we are going to give mainly an example of antifolate that interfere with the use of folic acid. So the use of folic acid is part of the normal process in the bacterial metabolism, and then that would lead to a competitive inhibition. So anti-metabolites may also be antibiotics because anti-metabolites can also be anti-cancer drugs, anti-cancer, anti-tumor. But we also have anti-metabolites that are antibiotics, and those antibiotics are often also used in the management of patients with cancer. So we have drugs like sulfanilamide drugs, which inhibit the dihydrofolate synthesis in bacteria by competing with what we call para-aminobenzoic acid, or PABA. So it makes them to be used in that situation because PABA is needed in enzymatic reactions that produce folic acid. We know on the mechanism, this mechanism, PABA is required in the production of folic acid. Then these act as a coenzyme in the synthesis of purine and pyrimidine. Those are the building blocks of DNA. So that's why when you read some textbooks, they actually classify anti-metabolites not as a separate group, but they classify them as nucleic acid synthesis inhibitors because they are the one that play a major role as part of the building blocks of nucleic acid. So just to recapitulate this, you have PABA that is needed as part of an enzymatic reaction to produce folic acid, and folic acid we know is a coenzyme in the synthesis of purine and pyrimidine, and purine and pyrimidine are used as building blocks for the formation of DNA. So we know that mammals do not synthesize their own folic acid, so they are unaffected by PABA inhibitors, which selectively kill bacteria. So this is also the basis for selective toxicity. When those drugs are used, they do not target human hosts because mammals do not synthesize their own folic acid. So, human hosts are not affected by those PABA inhibitors. So that's why they will kill bacteria and they will not destroy the human host. Then the drugs like sulfanilamide are not like other antibiotics used to treat infections, because they act by binding with DNA molecules and preventing RNA synthesis. That is a key step in the creation of proteins. So we can see here the inhibitors of folic acid synthesis that we spoke. So you have PABA, you have aminobenzoic acid plus pyridine. Here you have the enzyme called pyridine synthetase that convert this combination to dihydroteroic acid, and another enzyme called dihydrofolate synthase that converts this dihydroteroic acid to dihydrofolic acid. Then from here, we have another enzyme called dihydrofolate reductase that convert this to tetrahydrofolic acid. Then here we have the folic acid that is used now for the formation of purine and pyrimidine that are the building blocks for the formation of DNA as a nucleic acid. And we know from DNA you can have transcription to synthesize a single-strand RNA and so on. Okay, so then those drugs like sulfanilamide and the trimethoprim, they act here to inhibit folic acid synthesis. So they act at different sites. The sulfanilamide interfere with pyridine synthetase, and the trimethoprim interfere with dihydrofolate reductase. So that's why they interfere to try to block, the synthesis of folic acid. So we say that sulfonamide, or the sulfon, these antimicrobials are analogs of para-aminobenzoic acid, PABA, and competitively inhibit formation of dihydroteroic acid. So they have a broad range of activity against both gram-positive and gram-negative, and they are primarily used, they are good molecule to be used for the treatment of urinary tract infection and eosinophilic infection. Okay. Then the trimethoprim, and here we also have methotrexate and pyrimethamine. These drugs, these antimicrobials bind to the dihydrofolate reductase, as we saw it, and inhibit the formation of tetrahydrofolic acid. Okay, they also have a broad range of activity against both gram-positive and negative, and good for the treatment of UTI and nocardia infection. Now, this trimethoprim can be used in a combination with sulfonamide, and this combination help then in blocking the synthesis of folic acid at two distinct phases, then that prevents the emergence of resistant strand if they are used in combination. Okay, so let's move to our first test. Which of the following is true regarding the action of sulfonamide? Which of the following is true? Which of the following is true regarding the action of sulfonamide? We say that they increase PABA concentration and decrease their effectiveness. They inhibit dihydrofolate enzyme. They work synergistically with trimethoprim. They prevent the formation of folic acid, and they are bactericidal. Pause your video and check. Now the action of sulfonamide. So if we come back here, the sulfonamide actually don't interfere with dihydrofolate reductase. You can see that they interfere with pyridine synthase. And here we can see we have said that they are not bactericidal, they are bacteriostatic. So if you look at here, you can already eliminate Which of the following is true? So this is not true. This is not true. E is not true. B is not true. Which is regarded true? Okay. Prevent the formation of folic acid. They prevent the formation when they act here. They actually prevent the formation of dihydrofolate acid. That is still a precursor of folic acid, but it's not directly folic acid, but dihydrofolate acid. They can prevent that indirectly, but not directly. So we can eliminate that. Increase PABA concentration, decrease the effectiveness. When there is an increased PABA concentration, it decreases the effectiveness. No, actually they need PABA because they act by interfering with pyridine centers. Inhibit works synergistically with trimethoprim. I think we spoke about that. We say that these antimicrobial trimethoprim are used in combination with sulfanilamide, and this combination block two distinct steps in folic acid metabolism. So which of the following is true? Then we can see that C is true. The second question, which organisms are affected by sulfonamide? Remember we say that sulfonamide, okay, I give you 30 seconds to try the question. You can pause your video for 30 seconds and try the question, which of the organisms are affected by sulfonamide. Okay, you can come back and tell us. If we go back to sulfonamide, the spectrum of activity, we can see that they have a broad range of activity against gram-positive, gram-negative, and even nocardia. So they can be used, to treat even intracellular microorganisms. So here we can see that gram-negative rod, yes, they have activity. Gram-negative rod are affected by this. Gram-positive, streptococcus, staphylococcus are gram-positive. E. coli, okay, it's a gram-negative. It is affected by sulfonamide. What about chlamydia? That is an intracellular bacteria. Is it affected by sulfonamide? So I need you to tell me that. So you are going to give me an answer before we proceed with our topic 7, that is a case study. So we are going to have a case study and a clinical case that I don't want you to miss. And you need to respond to give me an answer during our last topic under our module 1 on antimicrobial agent. Thank you.